Good morning, everyone, and thank you for joining our Choosing Wisely 101 Round 2, a refresher course for us. So we're going to jump in and get started, but before we do, I want to make sure that everyone can hear me. If someone can just type into the chat box that yes, they can hear me loud and clear. Excellent. Thanks, guys. So we have about 18 of us here on the line together, so I am really looking forward to having a really interactive discussion as we kind of go through. I know, as we've mentioned before, this is kind of a refresher course for us. We know we did one of these last year and the year before, and we did some office hours, and some of us were able to be on those, and some of us had some conflicts. And then we've also got some new staff here. So for some of you, if you're very familiar, this might be a little bit of a reminder for you, and for others it might be new information together. So, but before we get started, just a reminder, we do record these and we will be posting them onto our Hinnovation subgroup for TCPI, so that way you'll have access to this for reference later, and then you can share it with your team members who maybe weren't able to join us. So, and for those of you who don't recognize my voice, my name is Katie Reese. I am the program lead for statewide strategies with the Iowa Healthcare Collaborative, and work very closely with the Compass PTN as part of some of our PSE work, social determinants, choosing wisely, and a lot of those different areas in through there. So really excited to have everybody with us today. So getting started here, the goals for our discussion today, we want to describe and explore Choosing Wisely as an initiative, and we want to also look at how we've integrated Choosing Wisely in through our Compass PTN work. So again, it's not something that stands alone, but this is really something that supports the work that we already have underway within TCPI. We're also going to highlight some of the valuable resources available through Choosing Wisely. Again, one of the key aspects for Choosing Wisely is that it allows us to not have to recreate the wheel. There's a lot of really good materials out there that we can use every day. And then I also want to make sure that we have time to discuss some of the real life examples of how we're using Choosing Wisely with our practices. And we've got a couple of our QIAs that are on the line here that have been doing some of those different works. But again, just a good example for us to have some time just to have some discussion around that. So what is Choosing Wisely? For those of you that are less familiar, Choosing Wisely is a national initiative that started off with ABIM Foundation, working with Consumer Reports, really looking at a national dialogue on how can we avoid wasteful and unnecessary test treatments and procedures, and really look at doing that through promoting conversation. So the key thing with Choosing Wisely is that it's not just about, siphoning care or getting people to stop doing things, but it's really about how do we prepare our providers to have those conversations, to know what are maybe some of those things that have become routine practices that maybe we need to cut back on, that don't have the evidence base to support how routinely we're doing them, or they're really costly, that we can kind of look at, maybe there are some new alternatives that we can look at. And then how do we also prepare patients to be able to engage in that conversation as well? So if a provider is going to say, no, we're not going to order that MRI, or we're not going to be prescribing an antibiotic, what are some resources so that way they understand that decision, and so when it's being made, that it's being made together as we go through those things. We want to make sure that there's no duplication, so we don't want to have multiple MRIs, multiple x-rays just as we go in between systems. And again, we always want to look at patient safety, reducing harm, and the best outcomes for our patients. So ABIM still helms the overall Choosing Wisely initiative. The really cool thing with this is ABIM might provide the leadership and kind of the platform for it, but there is really investment and buy-in from across the clinician network. So there are 75 plus specialty and professional associations who are partners and highly engaged in Choosing Wisely. This is where a lot of those recommendation lists and things like that, those guidances come from. It's not just ABIM putting those things out there, but it's coming from the experts in the field. There are also 34 plus consumer partner organizations, and those are organizations including the Iowa Healthcare Collaborative, where we come together and say, all right, we're going to buy into Choosing Wisely, we're going to disseminate those resources, and we're going to use you as a reference when we look through, and instead of, again, having to do this big, long search on what would be the best option, they have already put those things together with that evidence base and that buy-in from the specialty associations and those experts in the field. And then Consumer Reports was previously a co-lead, but they are still highly involved as a lead partner organization, and they did a lot with the patient materials and public-facing promotion. So that way, that's something for us to know that when we go on there and we look at those patient-facing materials, we can pull those things and know that they were done with validity, that health literacy was concerned. And so it takes off some of that guesswork and, again, that having to build up and recreate something that can either be a burden to us or to our practices. And as we go through, just a reminder for everyone, I'll be monitoring the chat box, so please type questions or comments in there as you go. We'll have some other areas, too, that will have some open dialogue in there. So again, the Choosing Wisely recommendations, when we think of choosing wisely, that's typically what we think of as here are these recommendations that everyone's putting forward. And so one of the key things with this is to know where those recommendations come from. And so those recommendation lists, so kind of those top 10 things to avoid or 5 things we should question, those come from those professional associations and societies, and they're asked to create a list of practices that are overused. So when they go through that, it's not just here are our top components for that, but they offer the guidance and the direction, and they give the clinical decision-making support. So again, when we're working with our practices, oftentimes we hear, so what's the evidence base for that? Where was that decision made? When they go through and do that, they have to pull those things together, and they build that body of evidence and pull from that literature. The overall component, too, is also reducing waste, improving patient safety, and healthcare costs. So all of those things are in alignment with our TCPI aims, the triple or the quadruple aim, and really what we're trying to do within healthcare transformation. So it's not just for the provider, but it's for the entire system and for our patient. And it's really, I think, when I think about it, I put it in terms of, it's about supporting the right care at the right time in the right setting. So those guiding principles that we have when we look at overall care coordination. So again, these recommendation requirements, again, it's not just a group of clinicians or someone sitting in a room, they come up with it, they put them out there without a system of checks and balances. So the requirement, in order for these to become recommendations that are endorsed by the society and organization that's putting them out there, but also by Choosing Wisely, is that they have to be things that we use routinely and or carry a significant cost. So they're high impact components. So we're using them too much or they're really high impact. And there has to be generally accepted evidence to support each recommendation. So typically it's not going to be something that is this one study that was done this one time. There's going to be a body of evidence that they pull from and that they cite when they put those recommendations together. The other key component, and this was one of those questions again, and I put these in here because this is stemmed from conversation that we've had with our providers and practices on where do these come from and really building in the buy-in and support for these. Are that each of those societies or professional associations are not going to be putting recommendations out for something that is outside of their scope or their purview. So, OB docs are not going to be putting something forward for family practitioners and vice versa. So again, it has to be within their purview and control, because the expectation is to, when they are putting these recommendations out, they're also carrying them through their education, their networks and guidance, and it's a message that they're carrying themselves independently, in collaboration with Choosing Wisely, but also then independently. And then there's a process of thorough documentation, and they have to make sure they're publicly available upon request. So again, this isn't something that we want it to be when they put it out there and Choosing Wisely endorses it. It's not something that, only their membership get access to that. That has to be something that's publicly available, not only for other providers to be able to support that, and for non-member clinicians from within their specialty, but then also for the general public. So again, it allows in that consistent messaging. So within Choosing Wisely, one of the other key things that we've kind of talked about are some of the different opportunities. So Choosing Wisely is not just here's a list of recommendations on a website and then there you go. Choosing Wisely is action-oriented. So they go through and there are a group of what they call their grantees. IHC had previously been a part of this when they first initiated, before we started implementing or integrating Choosing Wisely into all of our other initiatives such as TCPI. But these are some of the folks that go through, not only disseminate and educate on Choosing Wisely, but they actually get to be some of those testing fields. So as we go through and we look at those recommendations and we look at some of those materials that come from Choosing Wisely, we know that they've been kind of practice out boots on the ground. We've been testing them out, and so some of those different practices that come from that come from these grantees who are looking at expanding those things and implementing those best practices around those recommendations. Another key component for choosing wisely is that we gain access to physician champions. So these are clinicians identified by their specialty society partners or others, and they're actively working to advance that. So again, a lot of times when we go through, physician buying and having that consistent messaging can be kind of one of those challenges that can be difficult to navigate. And through choosing wisely, not only do we get these success stories that come from these grantees that are kind of doing similar work to like what we're doing within TCPI and testing it out and seeing what it looks like in practice, taking that evidence base and putting it into everyday practice, but also those physician and clinician champions who, again, can be a beacon and a voice and who can speak for them and can really carry that message. And they are very ardent and they are passionate about what they do. So again, we get access to these success stories that come from real life. So choosing wisely offers a variety of resources. And the really cool thing is that they've gone it through and done like an update for it. And they've really tried to put it into a variety of different ways. So again, where should I start? It's going to talk about what is choosing wisely, accounts from those early adopters, anecdotes from patients on the effects of overtreatment, all of those different background pieces, kind of building up that case. And then, am I choosing wisely? This is where it comes in, where it's the learning modules for clinicians that help them hone those communication skills that they have with their patients when they're looking at making those shared decisions, the avoiding unnecessary testing and overcoming those barriers to delivering high-value care. So again, where those recommendations are, but then also those support materials. So it's not just a list of what you shouldn't do, but there's support materials, again, saying, hey, here are different ways that you can do that. How would you implement that? Again, how can I implement choosing wisely in my practice or health system? So again, it's building upon that, those next step resources. So here's what you should or shouldn't be doing, and then here's how you can make that change and get that investment as well from your system and your practice. And the one that I like best is a newer ad that's about how do I implement choosing wisely in my community. This is really important because we recognize that in order for us to choose wisely and in order for us to engage our patients and choose making wise decisions about their health care and educated decisions, it goes beyond just the clinician. So this is another area where they pull together information for community organizations and employers who are looking to engage patients in the campaign. And I really think especially those community organizations, our community-based service providers, local public health, and our employers. Our employers have their employee wellness programs. They choose the health plans. Again, it just gives us some different timelines that we can go through and resources for those additional partners. This can be really great too when we're working with our patients and we're looking at social determinants of health. We can see who they're working with in those communities and see if they're using choosing wisely, again, because it's about that conversation rather than what we're just doing for or to our patient, but with our patients and families. So again, two of the key areas they have resources for. Again, the reason why this is so important is we don't have to recreate the wheel. We don't have to come at them and say this is something that Compass just came up with, but it's nationally accepted, it's nationally adopted, it's approved by their expertise society, the people that they have onus to. So again, there are those recommendation lists that are the top things physicians and patients that question. And it includes a wide variety, again, 75 plus different specialty and professional associations ranging from ED physicians to pharmacy, we have oncology, an incredibly wide and variant group of folks that are in there. And then again, those step-by-step guides and toolkits. So the AMA Steps Forward modules are part of choosing wisely as well. They look at systems level integration, and there have been other state partners such as the Washington State Choosing Wisely Task Force who's done a lot of work with that and has done some really preliminary work with, work with their payer communities. Guidelines for prepping the care team, and then practice and workflow scripting. So those are those key parts when we get out into our practice, say, okay, I buy in, I get it, it's important, but how do I do this? So again, those practice and workflow scriptings are ones that I have found to be very valuable. So just an example here, so 5 things physicians and patients would question. You could see it from the American College of Physicians. So it's talking about CT scans of the head and emergency department patients with minor head injury who are at low risk based on validated decision tools. So we'll kind of recognize that language from some of our own metrics as we go through. You're looking at even urinary catheters, so anything that's doing with those COTI. So again, it's supporting those other patient safety things. We know we have clinicians that are engaged with us that are still practicing in inpatient and hospital settings, so those things are important and through there. So again, none of these typically when we look at them stand alone are different than what we're kind of encouraging already, but again, add that extra level of reinforcement and confirmation. So here's an example of the workflow. So Maine Quality Counts, their toolkit for using Choosing Wisely tools to empower patients, you'll see they worked with their practices and came up with a workflow that said, here's the process we're going to go through from the point that they check in all the way to the point that they're with their provider and the resources that they can use. And they have specific scripting. So again, one of these things that helps them lead through, it shows how easy this can be. And then as our staff get more familiar and comfortable with it, then they end up making it their own, and it gets built in just to how they have some of those conversations. Again, so some of these other tools, so beyond just having it be the workflows, there's also this additional education that comes in there. So an example is the online interactive high-value care cases from the American College of Physicians. These have been found to be really valuable for our physician members who are looking for some CME. But again, tying into what they're getting from their professional association, I just wanted to highlight that because those are some really cool education modules. The tiering component, again, when we talk about these conversations, is we don't only just want to prepare our clinicians to have those and to make some of those best decisions when they are making orders, but it's also for our patients. So we know one of the key things is we're having our patients is an expectation for the care they receive, and having to get them on board sometimes where it might be different from what they're expecting. So again, in the cases of, you know, if they've got a sinus infection and it's been less than 6 weeks, then should they get antibiotics? What are those things that should be in there? So it really helps us to go through with a variety of these patient-facing education materials, again, to support those conversations. And they go beyond just kind of saying, hey, they shouldn't do this, but it gives a rationale and the support for that. So again, it reiterates what their provider is telling them, when things are appropriate, when they may not be. And it offers them some differing guidance on there. So it doesn't just say, hey, you don't need an antibiotic, but it gives them other examples. Again, so if the provider is saying, you know, maybe you would be using neti pots or some different, you know, a lot of this is just symptom management. How can you do that without having an antibiotic? Or how can you do that, you know, we talk about our opioids when we go through low back pain and things like that. So again, and it also explains what some of those common tests are, because what we find a lot with our patients is they don't quite understand what a CT scan is versus an MRI or some of those different things, and why we wouldn't want to duplicate those. What does that mean for them when they have that repeated exposure? So again, it gives them also the information that they need in order to make those educated decisions in collaboration with those providers. So a couple just examples. I know some of us, we've covered this as part of our previous things that are on here, but you'll see here, so imaging tests for lower back pain. So why you probably wouldn't need an X-ray or a CT scan or an MRI. It goes through when you might need to. It also then goes through, what I like is try this at home. So what can you do in through there? So from over-the-counter medications to, you know, looking at physical activity and stretching and those different things that a lot of times our providers give us. And to be frank, our patients sometimes, when they're given the stretching exercises and to use ibuprofen, we sometimes get kind of the eye roll with that. But this helps to reinforce that and reinforce that information as to why that's the best option, why we wouldn't want to go that next step. And then again, always if you have other symptoms, here's where you go in and here's kind of that next step. So you'll see on here too that with IHC being a partner organization on here, that we were able to go through, and we have these materials from Choosing Wisely that are co-branded with our Compass information that are on there. So that's a really cool thing. This one has a hint on there, but we have it for our Practice Transformation Network. So that's something that's really cool that when we take it out to our providers, it has our logo on there too. So here's another one for treating sinus problems. Don't rush the antibiotics. Here's the information that's on here. What else can you do when we go through this? And the reason why I include this one too is that there's such a bevy of these resources that are out there, and whether or not you're a partner organization or not, these are all available online. So if our practices were to go out on their own, they could find them. Our patients could go out on their own and find them. So again, that's the other thing too, is that they're publicly available. You don't have to go through kind of a network of gatekeepers in order to get to these. They're also available in a PDF, so they're really nice that our practices can even upload those into their EHRs or EMRs to be able to be part of that quick link that gets printed out with them. So the other thing, like I said, so they're all available online. The cool thing that they have with the website is you can go through and you don't have to go through and search a huge long list. That was one of the things that Choosing Wisely heard, is that there are so many recommendations that are out there. There are so many resources, and I cannot navigate them to know where should I pull from, what should that look like. So with their website update, if anybody's been out there recently within the last kind of, I'd say, 6 to 8 months, They did the search resources you could go through and you can change it. So you can search by a keyword. You can go by a society, a category, age. They have those resources that are in Spanish as well. So you can kind of see when I went through with antibiotics, it gave me 15 results and I could go through and check and see which ones are the most appropriate for me. So choosing wisely in the PTN. So again, one of the key things with this is unnecessary utilization reduction is a core component of patient safety and value-based care. And reducing unnecessary tests and procedures is one of our top 7 TCPI aims, so we know that. Choosing wisely was acknowledged from the beginning of TCPI as they kind of went through, and so it's been integrated as we went through that. And we looked at choosing wisely to identify and prioritize those utilization metrics and targeted interventions. So as we looked at our core measures, if you guys have been involved since the very beginning, you'll remember that we used to have 5, now we have 4. But when we went through and had to select and say, okay, what are going to be the tests and procedures that we're going to do? How are we going to prioritize this entire gamut, especially with all the specialties that are out there and the breadth of our network? We were able to build that off of choosing wisely. So in our experience as IHC, but then also in collaboration with those other national partners such as the Washington Health Alliance and kind of what they've done with the clinical-based and claims-based measures. And again, this allows us to have alignment with national quality measures and the quality payment program. So the one thing we don't want to do is have this be a standalone. And if nothing else, when we walk away from choosing wisely should not be this separate initiative or this siloed conversation that we have with our providers, but it should just be integrated into those goals that we have already established with them and where we're trying to lead them. So again, a lot of information here at the start of this, but we're going to be getting into some conversation here. So the Iowa 5 that we kind of used before, again, just some of those top 5 things that we had chosen when we first started off from the IHC experience. You'll see some correlation with our metrics that are there. So just call this out. This isn't the primary thing to be looking at, but when we selected those metrics that we have prioritized as our core in TCPI, we base off of our experience, again, with clinicians, so not just kind of picking out of a hat. So our utilization goals encompass, again, just highlighting the fact with those core metrics, when we initiated TCPI, we called out and said we would make these improvements here. We have these metrics that are laid out within there for reducing unnecessary imaging studies for low back pain, the percentage of CT or MRI for patients with primary diagnosis related to headache, and going on. So we know within our PTN that we have 4 of those metrics that really correlate back to choosing wisely. And have resources to support them. So again, these aren't just metrics without resources, again, when we're working with our practices. So whether it be adult sinusitis and we're looking at CT and overuse, if we're looking at ED utilization for head trauma, neuroimaging as we kind of go through that. So those are just key areas that we look at. The other thing before we get into discussion is I want to call out the fact that choosing wisely, again, has a clear tie-in with PFE. We've just gone through and done our PFE metrics with our honing in on health literacy and patient activation, and choosing wisely is a key resource, especially when we're talking about clear communication between provider and patient, engaging patients as partners, again, that nothing about me without me component, really making sure they buy in, so it's not just reactionary, but they're actually in partnership. And then the utilization of healthcare services. So we know the better educated, the better aware we are, the better able we are to make the better choice. So this is the 5 questions to ask your doctor before you get any test, treatment, or procedure. So this is where I always recommend that maybe people start when they're just doing choosing wisely, when they're talking about this. This is a really great opportunity that the practices can print this poster out and have it in their exam rooms. They can have it out in their lobby areas, their waiting rooms. But it helps to prep the patient to expect those conversations and not just to react to the doctor and expect them to initiate, but they can start those conversations as well. So do I really need this test and procedure? What are the risks? Are there simpler, safer options? What happens if I don't do anything? And then how much does it cost? That one always kind of gets hit with like a little whew from the providers on how am I supposed to know? And it's not necessarily the provider is supposed to fully be aware, but be able to talk about if there are less expensive tests. And a lot of our practices have taken to saying, hey, make sure you talk to your insurance provider beforehand, so then that way you can kind of lay those different things out as you go. So choosing wisely in PFE, a crosswalk, here's an example. So our PFE metric 2, even for shared decision making here, you'll see that when you actually go through the compendium and that TC I put out before, the choosing wisely 5 questions was actually put in there right from the start. So again, that can be a resource that helps us when we're using shared decision making as we go through and we're answering those questions and having that dialogue with our patient. So a quick demonstration just to kind of go through, and this won't take very long because I want to make sure we have plenty of time for conversation at the end, is that, so here is the website. So I talk about how easy it is to use. So I just wanted to give us a quick kind of 30-second review. So if you go to choosingwisely.org and we go through that, so you can hit our mission that's going to tell you about what Choosing Wisely is. So what do we look at? What is their goal in here? That really gives us that background. But the thing that I really appreciate is that I can get to the clinician list. I can go through here, I can click on a keyword as it loads up, and it's going to give me all the resources for that. So say that I go through and I'm looking for information on opioids. I can put in that keyword, I can search for it. Even as I go through that, I can continue to filter down, I can go through and look at what are the specialties that I'm looking at. And I can kind of find those. So maybe we've got chiropractors or cardiologists that are in here, family physicians, neurology. We know ophthalmology, that we have a variety of different folks that are in here, so it really allows us to go through and filter through what's going to be most appropriate for our clinicians without us having to do a whole lot of background with that and spend all that time looking that stuff up. So again, same thing for patients, so that way if you're sitting with the practices, you can kind of go through. The internet connection's been a little slow with this, but it looks very similar, and we've kind of had gone through that before. So this is how easy it is to use the website and how easy it is to find those resources. You can also get those success stories, so from those champions that are those clinician champions, but then also those grantees, so that way you can build off of that. And we frequently will review them and see what everyone else is doing for that. So quick demonstration, like I said, super easy to navigate with that. The really cool thing with the website is that you get up-to-date resources. They're constantly making additions that are on there. And again, those success stories are really cool. So you can see when you go to that primary page, you can sign up to get email notifications for it, but you'll also see the news feed where people are maybe tweeting about what's happening with it, so you can stay up to date with the national dialogue as well. They also created a new app. This is a really cool free download you can use it for iPhone or for Android devices. And you can kind of see there on the right, that's what it looks like. So you hit that clinicians, you can do the search, it gives you those lists, it does the same thing for patients. So I always recommend too that with our practice, you can go through, you can use that. So you don't have to always pull up the full web page, but providers can also have patients pull those different things up if they want to look through them. So if they've got really engaged patients and going through that, if they've got a PFAC, have their PFAC download the Choosing Wisely app and test it out and see how it works for them and get their recommendations for which ones were the ones that they found to be most valuable, that they'd like to see more of, that they think they'd like to have printed out in the practice. Again, our practice don't have to go at this alone to figure out what patient resource material should we have printed out and have available. They can use their patients to help them determine that. So here's a really cool Choosing Wisely app that's on the go. I know we've got some of our QIAs who actually use this rather than pulling up the website. They just use the app when they're doing an on-site visit. So with that leads us in really well. I'm going to unmute the lines because I know we have folks that are on here that are currently and actively using Choosing Wisely. Again, we've been using it for a while. We keep ramping it up and having kind of refreshers and looking at what more we can do, how can we do it better. But I want to give you guys a chance to share together. So how have you used Choosing Wisely, or if you're a little bit newer to Choosing Wisely, how, when we go through this, do you think that you could use it? So I'm going to unmute lines, so make sure if you've got background noise that you can mute yourself again. But lines are unmuted, so please, if you want to kind of pick up, I know we've got different folks on here. Mary might be on the line. That's on here. You can also put it into the chat box.
So as much as he wants you to find things and he wants to expose you to things that are like
the chat's coming in here.
Things that will teach you about health.
Mary, are you on the line with us, or even Texie? How have you guys used Choosing Wisely?
It's good FYI, but is it really actionable for you? Because who has my use something? It's like sending a high school.
I'm on the line.
Yeah, I haven't had that line.
So at Sanford
okay, I can hear you.
We have implemented Choosing Wisely BPAs across all of our systems. So I believe we started with a smaller amount of BPAs, kind of the more hot topic ones like low back pain and sinusitis, and then we've expanded from there. And so basically, if a provider orders something that is determined to be against one of the Choosing Wisely guidelines, it pops up with an explanation of, what they ordered, what the rationale is behind the Choosing Wisely guideline. There's a link for them to click out, and they can actually go view the full guideline. And then it gives them some buttons to take a different action. So they can either cancel the order or move forward and so forth. It's been a very successful initiative for us. We have been able to run some data in a system that we're currently piloting called LogicStream, where we can actually see if we're seeing less BPAs firing, meaning that we're potentially seeing a practice change happening where maybe they're ordering less antibiotics for sinusitis. It's kind of tough to make some inferences in data because some of that can be seasonal depending upon, the cold and flu season and things like that. But overall, we have been able to see some success.
That's awesome, Tessie. Do you guys, when you have that on there for you, again, kind of that clinical decision support, do you guys also use any of the patient resources or anything like that maybe pop up with that to say, hey, you can use this to kind of reaffirm that decision with the patients? Have you guys gone that far yet?
I believe they just have a shared decision-making conversation with the patient about the fact that this isn't recommended, and they talk about the guideline, and then they make a decision from there. I don't believe we give any handouts on it.
Okay. Yeah, so we've seen some that have done where they've just had that conversation, because sometimes depending on, where they're at, then they're like, we've already given them so many pieces of paper and done all of those different things, and so they didn't want to add another one on. They just want to have the conversation. And then others that it was kind of an auto print that would come out for them, like as part of discharge planning or part of their summary from their visit that was on there. So I'm always interested to see how people are using them.
I don't believe that we do, but I could double check.
Okay. And then we've got Brian Isis on the line also, and he was talking about one related to patient-specific goals of therapy when starting and taking medications. Brian, do you want to share with us?
Yeah, thanks, Katie. This is one that's been a pet for my being a pharmacist. And I've tried to really push this with the ABIM colleagues. Is that all right? Everything else in life, we have goals for what we want to achieve. You get on a medicine, you have no idea. Okay, why am I taking it? What is it supposed to do for me? And these patient-specific goals of therapy is maybe number 6 on your list is when deciding to take a medicine, discuss with your physician the specific benefits and reasons for taking the medication specific to you. And I just can't get any traction. The patients love it, but it's like, hello, Bob Waka and Rich Barron, I just can't get a warm fuzzy out of them. What about the group on the line? They find that maybe that helps with that in choosing wisely. It seems to make sense.
Anybody else from one of our QIAs or our practice folks want to speak up for that? So Brett, I think from my experience, and this is kind of in that realm, but not specific to that directly, but what I always did is, like I said, we called out that the pharmacy group was one of the groups that was a little bit latent to join as part of those specialty associations that actually put those recommendations out. And when I'm working with practices, when we talk about their network, we talk about that team-based care, we use this as a catalyst to say, okay, here's another opportunity. They can bridge that in. And so with working with them, figure out who are their practices that are doing that, who are, or their pharmacists in their area, and then sitting down with them. And sometimes when they're going through with those goals of care, when they have that, and I know some of our pharmacists are sitting down during that consult, writing that out. Some of them have like the little cards that they do with their medications, and then bringing that back with their provider, I think sometimes has been kind of like, oh, So if a pharmacist is using this and having that conversation with them, I should probably be in on that as well.
Yeah,
But that's kind of my experience.
you know, Katie, you hit the nail on the head saying that a pharmacy is a little late to the game. In fact, we've been so late to the game that pharmacists are not listed as eligible healthcare providers in the Medicare law that was passed in 1964.
Yeah, well, and you know, I think when we look at this, that this is again where I call out where choosing wisely doesn't have to be a standalone, but it could also be the catalyst or the vehicle when we're trying to build those relationships where it's kind of, we've been a little siloed before, and as we're going through and doing that. So I always encourage people, and I encourage all of us on the line, that if we have practices that are experiencing that we can use choosing wisely as that kind of, you know, sometimes we go through and it kind of sounds like rhetoric and some of the other things that we're doing. So when we say team-based care, sometimes that loses its pizzazz anymore. But if it's choosing wisely, and here's this other thing, and I can come at you and I can say, you know, your professional association that helms your, you know, your profession is saying to do this, then it carries a little bit more weight than just saying, hey guys, we should be doing this because it's the right thing, which we've had some successes with, but at the same time, there's only so much time in a day, and there's so many competing priorities that it doesn't always make its way to the top. So I think that's one of the other areas, again, when I talk about choosing wisely not being a separate conversation, but how can you weave choosing wisely into existing priorities and goals?
Great suggestion. Thank you, Kate.
But I've got a couple questions here. We will have the slides that will be out for everybody, so you guys will get those. We'll be posting those onto the resource library that we have on our subpage within Innovation. We'll also be doing some updates on there because we have those co-branded materials. We know some of those made it into different folders that are in there, but so that way it's super easy for you guys to navigate and find those over the next week or so. We're going to be putting those together into that one area so you can find them pretty readily. So anybody else? So one of the questions that I have is that I know that when we go through this, and there, again, this is a safe space, there's no wrong answer here. For some of you that maybe haven't been doing a lot with choosing wisely yet, where do you maybe think that this would fit in, or where would you think that if you're going to initiate some of these conversations or sharing, where do you envision that that would work best for how you're having conversations? And we also have some folks that are within our TCPI network, but then also within some of the others that are out there, which I think, you know, some of the state innovation model folks, you know, so one of the key things too is that this isn't just something that is just within TCPI. This is something that I think really supports folks from across the realm. So for those of you that are on the line, even if you're not TCPI specifically, you know, initiative, I welcome you guys to speak up and share. All right. One of the really cool things, so we have our Choosing Wisely group within TCPI, and what I hear from some of our other staff is using that app. The app has been really helpful because it doesn't require them to get online, having a laptop, making it bulky. And some of the feedback we've gotten is that they're using that app, it makes it seem so easy and breezy that initial kind of hesitant to like add another kind of log to the fire and say, okay, one more thing to do, has been really helpful. The other thing is too, when they're going through and perhaps maybe with their practices that are working on patients that are going through, and it could even be part of their health coaching. So some of the health coach patients that are there, they have them download the apps, and then that way they can search through it. Or if you're working with a pediatric office, a lot of times the parent might download the Choosing Wisely app, because then they can go through and they can kind of look up, okay, should I be getting antibiotics for this? Should I not be? What are some of the other things, even before I go to the doctor, that I might want to make sure that I'm doing as we kind of go through that. So those are just some of the other things that we've heard. I know Wisconsin has a very robust and active Choosing Wisely initiative that happens within the state. I don't think Judy was able to be on the line with us, but Judy, if you are on, and I don't see you, please speak up. Kansas, I know, Jill, are you on the line? I know when we were listening in on our last QIA call that you guys were sharing some of the work with the American College of Radiologists and the R-Scan.
People have their camera on the screen.
And then, so I'm getting another chat here that is, I really appreciate that. This is something that needs to start at home. We need to educate our family and friends as well as our physicians that Choosing Wisely is out there. education is the key to giving patients the tools they need to help them with their own healthcare. And I could not agree more. I think this is vitally important. And that starting at home, this could be an opportunity with our practices to integrate Choosing Wisely before they're even needing to make some of those different things. So in advance of, when they're having to make a decision about, do I get a test or procedure, do I get antibiotics or medication, having that out there in advance. So that's where a lot of those posters or asking them to have those questions, to think critically about what kind of care they're getting can be really helpful. Okay. All right, we'll kind of move ahead here. So learn more and access resources. The really cool thing, again, is that we don't have to recreate the wheel. We have support that's out there. So within the Compass PTN resources on our the web page that is off of IHC's homepage, with our Compass PTN resources, you will see resources for Choosing Wisely that have been integrated in throughout those areas and support areas as well, including we've done the office hours that have been previously recorded. And then we also have the Program Staff Innovation Group for TCPI. I know we had a question for that website, so we can kind of send that out there. So that's part of that Health Doers website. And the reason why we go through that and we do some of those things rather than just straight email is because that resource library is there. We don't have to go searching through and try to find something that maybe somebody sent out before, but we can just go to the resource library, click on the topic that's there, and see those resources. It'll be in there. So if you guys are already enrolled and enlisted into the Health Doers group, you will see some updates coming through and your kind of at least your weekly summary of activity that will show that we're going to be updating some more of those different areas. And then we also have our IHC's Choosing Wisely webpage. And so that, again, that came from a lot of our work when we were a grantee at the initial stages of Choosing Wisely before TCPI, but kind of informs a little bit more of the work that we had done, but then also gives some feedback as far as some of those other resources that we can use with our practitioners. So always want to make sure that folks are aware of that. Again, you guys will all get copies of this slide deck, so you'll have those links that will be active for you, so you don't have to worry about writing them all out. So open discussion and Q&A. So I don't want to just have people that are sharing, but I want to hear from you guys. I know we've got people of varying degrees of familiarity. So have any questions about Choosing Wisely, or what more do you want to learn about? How do you want us to give you that information? Do you like these webinars? Do you want it to be different posts? What works for you guys? Choosing Wisely has a lot of tools and resources. But maybe there's something that's missing that we can work together on to create, so that way we can fill that gap. I'm also happy to hear what our practice is saying about it. So when we're using Choosing Wisely, what some of that feedback that they're giving us. I know Tessie was able to share with us that it's been really, really valuable for their clinicians. They've worked it in with clinical decision supports that are in there. But we know we've got some folks too that are doing it with smaller, more independent practices. So I'd love to hear from you guys. So again, lines are unmuted. You can put it into the chat box.
Hi, Katie. This is Annie in Wisconsin.
Hi, Annie.
So one of our kind of barriers with our providers when we ask them to use like the cards and talk with their patients about the 5 questions is the cost piece. Because it makes them very uncomfortable about not knowing and not having answers. So I guess I would be interested in hearing from anybody else who's overcome that barrier and what they've done with their providers in order to make it a little bit more of a comfortable conversation for them.
All right. Anybody have any experience with having those conversations with the practices, or have practices that have gone through and found the investment to be able to print those things off and have those handouts ready for patients? I know I've heard from some of those folks when they've kind of gone through that we could get some practices that said, okay, I can do I'll print it off in color that's on like just the standard letter size paper, and I'll post that up in the exam room. Maybe they'll do one poster or something. They can commit to kind of the $20 that it takes to do a glossy poster that's for out in the lobby and through there. But for some of the other things, they've used the app for some of them. I think that's where, when we went through and why Choosing Wisely put the investment into doing an app, is because then that way it's right there at the patient's hands and they don't have to print them out. Most frequently, patients are on their phones already, then they can kind of share that with someone else. But I know, when they're going through and they're working with those very tight budgets, to add anything additional, even, $30 to $50 can sometimes be difficult for them to kind of justify. So.
I'm sorry, Katie, I don't think I was very clear. I mean, like the cost to the patient, that fifth question in the 5 questions to get your provider. Although the budget is always an issue too.
How about anyone on the line for that one? How do your providers have conversations with patients about the cost of their care?
So this is Sammy from Sanford, and we actually recently developed a phone number that we can provide to our patients for them to call. You kind of think of it as like a helpline, and they can call to get the costs of their tests. So it's just 800 number. It's kind of a one-stop shop. And so that is how we have helped overcome that, because you're right, there's no way a provider can possibly know all the costs of everything, and then they're constantly changing, and then based on their insurance, it varies as well. So that's how we've addressed that.
Who staffs that 800 number?
It's patient financial services staff. So like business office type people.
Okay. Thank you.
And Sammy, this is Katie. Are they able just to give them information as far as what they would bill for, or are they able to give the estimated expense with the insurance coverage?
They give them what they would be billed for, and they can give them the code so that they can contact their insurance if they need.
Awesome. All right. How about anybody else? I know we're kind of hitting in at our kind of 45 minutes. We try to keep this to, but I'm happy to stay on for discussion and keep going. And this has been really great to hear from everybody. So anybody else using some of those things, or have some, some barriers or challenges that they're seeing in the field that maybe we can help brainstorm together? All right. Well, in true Choosing Wisely fashion, this refresher course was just the initiation of this conversation. So this is something that will be ongoing with this. So when I say, what more do you want to learn? How do you want to learn about it? What other resources and tools would be helpful? I mean that genuinely. So please be sure to share with us and tell us, what it looks like, how it's going. We kind of have a little Choosing Wisely work group with some different representation from our partners throughout our network. That we kind of work together on this. So you can email me or pose the question on Health Doers. So in that little group, because if one of us has that question we're going through, we probably all have it. So don't be afraid to go in there and use that platform to share and to go through, and we can kind of brainstorm again. We get to be a little think tank together. So really appreciate everybody's time today. And again, this was recorded, so we'll make sure the recording is available to everyone, as well as a copy of the slide deck that will be put into the Innovation the Health Doer site that's on there. I'll probably also email it to our group just in case folks aren't in on the Health Doers component for that. So, but really appreciate everyone's attentiveness and sharing, and we'll look forward to keep having our Choosing Wisely conversation. So thanks, everybody. Have a great day.